Of all the occupational health and safety hazards to which the average worker may be exposed, biological hazards such as viruses, bacteria, and fungi are among the least common until now. The emergence and spread of the severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, in the past few months, and the number of workers infected across occupations and industries is unprecedented. Today, as workplaces plan their reopening and workers return to work, the potential for exposure to the virus is even greater, making this virus and the disease it causes one of the most significant threats to worker health and safety we've faced in our lifetimes. Hello, I'm Lisa Hawkins, a Program Development Officer with the Workers' Health and Safety Centre. As Ontario's designated health and safety training organization, we deliver a wide range of classroom and now virtual training courses to assist in making your workplace healthier and safer. This webinar is one in a series we are developing to help keep you safe throughout the pandemic. Today's topic is on the characteristics of the virus that causes COVID-19. This webinar will focus on physical and chemical characteristics of the virus, origins and emergence of the virus, routes of transmission, COVID-19, the disease caused by the virus, testing for the virus and antibodies, vaccination against the virus, and making your workplace safer from COVID-19. Unlike bacteria, viruses require a host, a living cell, plant, animal, or human, to reproduce. A virus consists only of genetic material contained within an envelope of proteins. Many viruses use RNA, or ribonucleic acid, to code, regulate, and express their genes. Proteins on the surface of a virus are uniquely configured to seek and attach to a specific receptor on the outside of a host cell. Once attached, the virus enters the cell and hijacks its genetic material to copy itself. After replication, it exits the cell and proceeds to infect others. Coronaviruses are a large group of viruses in the family Coronaviridae. They are one of the largest viruses identified to date that replicates using RNA. This group of viruses are round, with club-like spikes projecting from the surface, creating an image similar to the solar corona, for which they are so named. Simple coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, or MERS, and Severe Acute Respiratory Syndrome, or SARS, which killed 44 people in Ontario in 2003. The scientific name for that virus was SARS-CoV-1. The most recently discovered coronavirus, SARS-CoV-2, is the virus that causes the disease COVID-19. Like all coronavirus, this virus is spherical in shape. It typically measures between 60 and 140 nanometers in diameter. The exterior is made of 4 different proteins, ranging in size from 9 to 12 nanometers. The largest of these proteins, the S or spike protein, is important because it has the ability to attach to the ACE2 protein. This protein is found on the surface of many different human cells, including those in the lungs, arteries, heart, kidneys, and intestines. The virus binds to ACE2 like a key inserted into a lock to gain entry and infect human cells. The image on the left shows the virus with its RNA in blue and the S spike protein in red. On the right, we see an image of the spike protein binding to the ACE2 receptor, giving the virus access to the cell. SARS-CoV-2 is zoonotic, a virus that normally exists in animals, but can infect and cause disease in humans. While the exact origins of the virus are not yet known, 2 scenarios have been proposed. Either the virus jumped from an animal to a human directly, with the ability to transmit from human to human, or the virus jumped from an animal to a human and then acquired the features necessary to transmit and infect humans after. It is thought that this virus emerged either directly or indirectly from bats. Bats are known to carry hundreds of coronaviruses. Either the virus was circulating in bats and jumped to a human, or there was an intermediate host, such as a pangolin, a nearly extinct animal that lives in Africa and Asia. Transmission of the virus occurs predominantly by respiratory droplets expelled by an individual infected with the virus during a cough or sneeze, and in some cases during speaking, singing, or heavy breathing. 99% of droplets are large, greater than 5 microns, and fall rapidly to the ground within a distance of 1 meter or less. Droplets smaller than 5 microns, also called droplet nuclei, may remain suspended in air for significant periods of time and can infect if the virus directly contacts the eyes, nose, or mouth of another individual prior to settling on a surface. Once respiratory droplets fall to a surface, they can remain viable for several hours to several days. Workers can also be exposed to the virus through contact with a contaminated surface if they touch their eyes, nose, or mouth with their hands. The Centers for Disease Control in Atlanta, Georgia estimates 25% of transmission may be due to asymptomatic or pre-symptomatic individuals. Spread by asymptomatic and pre-symptomatic individuals is a key characteristic of the virus and part of the reason it has been so successful in spreading. To estimate how easily a virus spreads, scientists calculate its base reproduction number, or R0. R0 predicts the number of people who can catch a given infection from a single infected person. Currently, the R0 for this virus is estimated at about 2.2, meaning a single infected individual can infect, on average, 2.2 others. By comparison, the flu has an R0 of 1.3, making this virus much more infectious than influenza. One defining characteristic of SARS-CoV-2 is its role in superspreader events. There are several examples of superspreader events that have resulted in disease. Infections have been linked to dormitories of migrant workers in Singapore, to live music venues in Japan, and exercise classes in South Korea. Any large gathering of individuals in close quarters presents an opportunity for spread. While the R0 of the virus is 2.2, in reality, the situation is much more complex, with some infecting many and others not spreading the disease at all. Certainly, any of the situations outlined on this slide increases the risk of transmission. Why coronaviruses in particular cluster more than other pathogens is unknown. The mode of transmission may be a factor. Transmission by aerosols has been a component of many clusters studied to date. The characteristics of individuals may be another. Some shed more of the virus and for longer periods of time than others. Studies have shown some breathe out more particles than others when they speak, and singing may expel more of the virus than talking. It seems clear transmission is much higher in enclosed spaces than outside. A study in Japan found the risk of infection 19 times higher indoors than out. Those working closely together in facilities where temperatures are low, such as meatpacking plants and perishable food distribution warehouses, are particularly vulnerable, as the virus survives longer in colder temperatures. Other workplaces at risk include those which are loud, requiring workers to shout, like a noisy restaurant, or where work is strenuous, causing heavy breathing, like construction sites. Infection with this virus causes a disease now named COVID-19. The time between exposure to the virus and development of symptoms can range from 1 to 14 days, but the typical onset of symptoms is between 5 and 6 days. The most common symptom of COVID-19 are fever, dry cough, and difficulty breathing. Other symptoms such as aches and pains, nasal congestion, headache, sore throat, diarrhea, loss of taste or smell, or a skin rash, or discoloration of fingers or toes are less common. These symptoms are usually mild and begin gradually, but can worsen, requiring hospitalization. Approximately 80% of individuals confirmed to have the disease recover at home. However, 1 in every 5 can become seriously ill and require medical care. Those who are older and with underlying health conditions like high blood pressure, heart and lung problems, diabetes, or cancer are at higher risk of developing severe forms of the symptoms, which can lead to death. This is exactly what happened to thousands of elderly and vulnerable residents in long-term care homes in Ontario. The virus was quickly isolated for study, allowing tests to be developed for its presence. German researchers released the first diagnostic protocol for COVID-19 using swab samples from a patient's nose and throat. Endorsed by the World Health Organization, this test is now being used by hospitals and clinics around the world, including Canada. There is also a test for the antibodies our immune system creates to fight the virus. But this is an area of controversy and caution. Having the antibodies implies a person has been infected with the virus. It is generally believed a person with antibodies cannot become infected again. If a person is immune, all the precautions the rest of us need to take don't apply to them. However, the accuracy and reliability of such tests remains a question. Inaccurate tests can give a false positive, suggesting a person who's been infected hasn't, or a false negative, meaning a person is immune when in fact they're not. Neither situation works for the individual or the population as a whole. Vaccination is the most effective method of preventing infectious disease. Polio is a case in point. The same holds true for this virus. There are efforts underway to develop a vaccine, but these take time. Even after development, trials need to be done to test effectiveness and possible side effects. So while the work continues, we need to take all the actions we can. As we've seen from other jurisdictions, it's not inevitable that this virus causes mass infection. It is possible to stop the spread. Telling people to stay home as much as possible and physically distancing when out, closing schools and workplaces have all been effective at reducing the R0 of the virus. The past 8 weeks has intended to flatten the curve and provide time to prepare other strategies to counter the virus. The public health strategy most talked about lately is testing, tracing, and isolating. How testing fits into occupational health and safety is the subject of a future webinar. The challenge now is to monitor our workplaces for signs of the disease and to change the workplace to stop the spread. A hazard assessment completed by a joint committee or health and safety representative can spur these changes. Understanding where workers may be exposed and how will help determine controls. A number of controls are necessary to protect the worker from the hazard posed by this virus. In the hierarchy of controls, controls closest to the source are best, followed by controls along the path. Controls of the worker should only be used when other controls are not possible or as a supplement to other controls. In addition to a series of webinars on COVID-19, the Workers' Health and Safety Center is now offering virtual learning experiences. We've modified a number of our most popular programs such that they can be delivered via virtual classroom. Recently, we added a course specifically on the hazards posed by the virus that causes COVID-19. You can register for any of our programs by visiting the website. This seminar, as well as others we posted in the past, are available on our YouTube channel. This presentation will be posted on our website after the webinar today. While all of us at the Workers' Center are now working from home, we can still be reached by telephone or email. You can also follow the latest developments via Facebook or Twitter. Let us know how we did today by completing the poll posted on your screen. We will now be answering a few questions on this subject. Any questions submitted during the webinar will be answered and posted to our website at a later date. What does COVID-19 actually stand for? CO for corona, VI for virus, D for disease, and 19 represents the year it was discovered. How many different types of coronaviruses cause illness in humans? 7. There are 7 coronaviruses that infect and cause illness in humans. 2 cause the common cold, 2 cause influenza, and 3 cause severe respiratory illnesses. MERS-CoV, the virus that causes MERS, SARS-CoV-1, the virus that causes SARS, and now SARS-CoV-2, the virus that causes COVID-19. Why do scientists believe SARS-CoV-2 originated in bats? 90% of the genetics of a common coronavirus that circulates in bats is the same as SARS-CoV-2. Scientists have speculated that the virus originated in bats and then jumped to humans. How is SARS-CoV-1 related to SARS-CoV-2? The genome or genetic material of the two viruses are very similar. The clue is in the name. Thank you for joining us today. We look forward to seeing you at future webinars.